Persons with kidney failure are at a higher risk for contracting the coronavirus. And with the borders opening up in a few days, local doctors are deeply concerned about the threat this may pose to the group. Our LaDawn Davis spoke to a local nephrologist to find out how the virus has affected them over the past 3 months.
We've had only one patient that had a cough last week. They went outside, they went to the public health and were tested. They were negative. But then a cough alone is very low risk for having the disease.
Nephrologist Dr. Adrian Sawyer says so far there are no confirmed cases of the coronavirus among persons battling kidney failure in this country. He says he credits this to the effective reinforcement of his team's infection control measures that were heavily influenced by the CDC. In an interview with ZNS News this week, Dr. Sawyer revealed how Covid-19 has indirectly impacted the treatments of patients.
A substantial number of our patients who in fact come for dialysis, they're sponsored by the Public Hospitals Authority. The hospital system have been only doing emergency surgeries. The labs have only been doing what they consider emergencies. It means that we've been affected indirectly in that patients who need routine management decisions have not had them. Some patients who were scheduled to have access surgery, in fact, have not had them because they've been put off.
But Dr. Sawyer says his biggest concern is that COVID-19 may possibly be around for much longer than we think, putting a dent in the opportunity for patients to get a kidney transplant.
The risk is if they get COVID, then it may affect their eligibility to get a kidney transplant. And I am aware that there are people who there's a risk in people who have had kidney transplants. If they get COVID, their outcome and their risk of getting rejection of their kidney or in fact getting another viral illness that can have adverse effects on them are higher.
On July 1st, the country's borders are expected to open, and according to Dr. Sawyer, visitors with kidney failure will also be accommodated, but only after they go through a stringent process first.
Like everywhere else, they go through a list of tests that they have to have before they come. And likewise, some of our patients who have to go to the U.S., we have to do certain tests here and send to the units they're going to. Naturally, because the borders have been closed, we've not had to accept anybody here. And because the nature of transfer with transient patients is such that you have to do it weeks in advance, we haven't started that yet.